Thank you so much, Katie. I'm so excited to be here. I want to thank Miles for Migraine first. I mean, this is just the most amazing advocacy organization. I'm so happy to be invited to be here with such an awesome group of people who are doing so much for migraine, research, for migraine clinical care, and the focus groups and the mindfulness groups. I mean, you're also doing things for individuals and your community, and I just think it's fantastic. I also want to thank specifically Rock, as well as all of our other patients who participate in our studies, because we wouldn't know anything I'm going to talk about today if people with migraine didn't take hours and hours and hours out of your life to fill out our little diaries 3 times a day forever and ever and ever, so that we can do some fancy math on the back end and try to figure out what's going on. So I just want to thank you specifically. It was just absolutely our pleasure to have you in our study, but also I'm sure that there may be other people on this call who have taken surveys, taken drugs that were new, taken devices. Every time you say yes, that's one more piece of information that we have to kind of figure out the migraine puzzle. So thank you so much, everybody, for all of your help in understanding what's going on. So today we're going to talk about routine health behaviors in migraine, and I really want to address myths and then a little bit of facts, with the caveat that it's science. We're figuring out the facts every day. Every day we're learning new things, and participating in research helps us do that. So here's a myth about stress that I hear all the time. You have migraines because you're so stressed out. If you would just calm down, you wouldn't have so many migraines. Right. This is clearly completely not true. You have migraine because you're genetically predisposed to have migraine. So anybody, any human being can have a migraine attack if their personal threshold is breached. In fact, it's really common. Most people do have 1, maybe 2 migraine attacks when they have a really, really, really bad, weird day. But people in this group, we have migraine because we have a genetically lowered threshold for having migraine. And that's just why. For some people, being stressed is a good indicator that a migraine attack may be on its way, like we just heard. But for others, there may actually be no relationship between stress and migraine. It actually seems to be a pretty individual thing. So this blanket idea that, you got this because you're stressed out is both untrue, but it's also unhelpful for many people with migraine. The next myth is you get migraines because you don't take care of your body. If you would get more sleep, if you'd work out, your migraines would just magically go away. No, remember, you have migraine because you're genetically predisposed to have migraine. That's why. But migraine attacks interfere with sleep and exercise. It is hard for people with migraine to get a good night's sleep. And it's hard for people with migraine to engage in exercise because one of the criteria of a migraine attack is it gets worse when you're physically active. It is hard to keep an exercise routine as a person living with migraine. With tools, you can get better sleep. You can more regularly engage in aerobic activity. And if you do those things over a long period of time, you might feel better overall. And there's some evidence that says, hey, you may even have a reduction in your migraine attacks. The last myth is you just have to stay away from this food. Otherwise, you'll definitely get a migraine, right? I think everybody's, aunt has their food that they think causes migraine attacks. So again, you have migraine, not because you ate certain terrible foods, but because you're genetically predisposed to have migraine. Certain people may find that certain foods often trigger migraine attacks. However, there's a lot more going on. Part of your migraine attack, we call it the prodrome, it happens right before you feel the pain, may actually involve craving certain foods. So it may not be that the chocolate is causing the migraine. It may be that your migraine has actually already started, and part of your migraine is craving chocolate. The second thing is that skipping meals seems like it's probably going to be more important for migraine attacks than specific food types. So keeping a really consistent, healthy diet seems to be the best thing to do for people with migraine. And in fact, there's very new research that we need to do more of with more people, but very new research that suggests that any kind of healthy diet you might keep, Mediterranean, My Healthy Plate, really pretty much anything you do to try to just eat healthier broadly does seem to help people with migraine improve their quality of life and may even reduce migraine attack frequency. So it's more about, and we're going to talk about this, but just living a consistent, healthy lifestyle at the end of the day seems to be more important than any of these really specific food triggers that we may be worried about. I think this is one of the biggest myths about behavior change. So this is where I want to kind of start, my big part of the presentation. So when does behavior change matter? Well, when you think about migraine attacks and migraine management, there are two strategies basically. You can have preventive strategies, which are strategies used every day to reduce migraine frequency. And then you can have acute strategies, which are strategies that you use early on during the actual attack itself to treat the attack. We wish behavior change strategies could treat the attack. There's just no evidence. There's just no evidence that there's anything that you can do at the time of a migraine attack that will necessarily reduce how often how long it is, or reduce how severe it is. That's the time when the treatment strategies you have worked with your physician on are so critically important. An acute medication, a nasal spray, a device. There are things that you can do to help feel better. Dark room, ice pack, hot compress, these kinds of things. There are things you can do to distract yourself, meditation, relaxation. You can try to remove yourself from things that might make it worse, like bright lights or stress. But we don't have very much evidence that says behavior change in this time matters. What we do know is that these really consistent behavior change strategies, using things to kind of improve the consistency and healthiness of your life every day, can be used to reduce how often you have migraine attacks. So consistency is key. Consistent routine behaviors are the primary way people with migraine can harness their lifestyle to try to reduce migraine frequency and impact. There are a couple of other kind of newer ideas that I think can also help us understand which behaviors we really need to worry about being consistent. So what's happening during a migraine attack anyway? I don't want to get into too much detail because I want to make sure that we're timely, but basically, during a migraine attack, your brain becomes more and more sensitive to all of the things around you, and the pathways that are sensitized are pathways that are associated with pain and specifically in your head. The threshold model of migraine is the one that I often use when I try to tell people why lifestyle matters. So your migraine threshold is the point at which your brain can have an imbalance, an inconsistency of hormones and other things going on in your brain. That's the point at which you'll experience a migraine attack. So for some people who don't have migraine, the disease, their threshold is just really, really high. They could go through all sorts of things and they wouldn't have a migraine attack. But for people who have migraine disease, their threshold is lower. So it takes less imbalance in your brain for you to experience a migraine attack. So things like skipping meals, stress, poor sleep, those are all things that can potentially be migraine attack precipitants. So the goal of behavior change strategies is to either raise your threshold or avoid the specific things that might be causing the imbalance in your brain. The last kind of key thing to understand about behavior change and migraine is surprise. And this is kind of new research, but very, very fun. And I think it's helpful. Inconsistency in your lifestyle seems to matter more if it is surprising, which means there's a kind of fun, again, back-end math geeky thing about the extent to which that behavior is unusual for you. So the way I think about it is, if your best friend or your partner, whoever knows you really well, would be surprised if you skipped breakfast, slept in, drank wine, it seems to matter more for migraine attacks. So if you're the kind of person whose sleep is really, really inconsistent, consistent sleep might help you, but on any given day, inconsistent sleep is unlikely to matter as much. than if you never, ever, 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 ever drink wine and you have a glass of wine. So when something is surprising, it's more likely to potentially be a migraine trigger for you. I think that this may actually be, and this is totally, Betsy Seng hypothesizing, but it may be why travel always comes up in every single survey is such an important migraine attack precipitant. Every survey, you look at the top three and travel, it's stress, travel, and something else. So travel's always up there. And I think, travel, everything's unusual. Your sleep is weird, your food is weird, your schedule's weird, everything's weird. And it just is a migraine attack precipitant, whirlpool. So what should you do with this information? If you know that one of your very regular behaviors is going to be different, there's kind of two things to do. You need to prepare for the fact that you may have an attack. And then you need to take care of yourself by keeping everything else as consistent as possible. So this is my prepare and take care slide. When you are prepared for an attack, you have your medication or whatever other acute strategies you have with you. If you know something is going to be weird about a day, or if you're worried you may have an attack for some reason, make sure you've got your acute strategies with you, and then make sure you know what the plan is going to be if you have an attack. There's nothing wrong with being prepared. At the same time, you may be able to avert having a migraine attack. If you know something is going to be off or weird about a day, you can take care of yourself in other ways. If you know you have a big presentation that you'll be stressed out about, try to get sleep the night before. If you know that your sleep is going to be totally disrupted or it already happened, take care of yourself the next day. Make sure that you get a walk at lunch. Make sure that you eat routine, healthy, food throughout the day. By taking care of yourself when you're worried you might have a migraine attack, you may actually be able to avert the attack itself from happening. So stress, why does stress matter? I want to go through a couple of behaviors. Why does stress matter? Well, stress is not one thing. And I'm sure that you've noticed this as you've talked to your friends and family members. Some people find something stressful and other people can experience the same thing and they don't find it very stressful at all. And all of our, metrics for stress, 0 to 10, it's different person to person. And there are a lot of reasons for that. Stress is actually three things. This primary appraisal is when we ask ourselves, is this stressful? Is this thing that's happening to me stressful? Somebody jumps out to you, in front of your car as you're driving. Is that stressful? Well, maybe. The thing is that just because something might be stressful doesn't mean it has to be. There's a second appraisal. The second appraisal is, well, can I deal with it? So if somebody jumps out in front of your car, but you're an experienced driver, you can easily brake or avoid them. It's kind of like, oh, that happened, but was it stressful? Probably didn't feel very stressful. You're used to it. If you're a new driver, you just got your driver's license. You're driving to work for the first time and somebody jumps out in front of your car. Oof, you don't have the tools to cope with it as well. Hopefully you avoid them, right? Hopefully it goes okay, but your heart is probably still pounding. It's going to affect all the rest of your day. It was perceived as stressful. So stress is actually three things. It's whether it's an event, it is, can I cope with this event? And then it's your body's reaction. All three of those things do not have the same effect on migraine. We're just learning why stress might actually matter for some people. With high stress, there are physiologic changes that do probably lower the migraine threshold, at least for some people. There is also the phenomenon where if you change from really high to low stress, vacation, weekend, you may have a letdown headache. So that's, again, a change in the balance of your brain, especially if you have a stressful job normally. That low stress period, it's a surprise. And then finally, there's some evidence that indicates that stress may be your brain's signal detector as a migraine early warning sign. Your brain may be always scanning for the other imbalances in your life that are associated with migraine. So, how often is it that you sleep in and you're late for work? That's stressful. You skip breakfast, that's stressful. Your travel plans change. Who has spent time on airline calls, right? That's stressful. Haven't exercised this week, right? It's stressful. So stress may be part of our brain's way of saying, hey, something's off. And when things are off, that's more likely to be a migraine attack, period. There are a couple ways to manage stress. The first big way is called the relaxation response. That's going to be anytime you use deep breathing. Deep breathing is when you breathe in with your stomach and then out. So your stomach expands when you breathe in and out rather than your chest. It can be hard for some people to learn. We go through this a lot. I have people lay down flat on their back in the office. It's a lot easier to learn that way. And then any kind of muscle relaxation that builds on that. So progressive muscle relaxation, you use deep breathing to relax your muscles. Same with body scan. Autogenic training is a way to do relaxation faster, where you always think of a word while you're doing deep breathing. So then if you're going throughout your day and your boss is talking, you can think about that word. And the hope is that physiologically your body will go back to that relaxed state. Relaxation response is the best way to manage stress. But for some of us, even when our bodies don't feel stressed, our minds still go and go and go. And that stress still exists in our mind. For that, mindfulness can be really useful. Mindfulness uses meditations and thought exercises to help cultivate a non-judgmental awareness of the present moment. It's a very different way of thinking about life. I know for myself, I'm always worried about what happened, and I'm always worried about what's going to happen, later. I'm a slave to my calendar, but mindfulness is all about being a slave to the present moment and to be really fully immersed in the present moment. It's hard to learn. It takes a long time, but it can be really rewarding for people who are interested. So what do you do about stress? Well, you can use stress to tell what's going on with your body. You can use stress to say, hey, how likely is it that this is a migraine day? Should I have my medications with me? Should I have my stuff? Should I be prepared? And then when changes in stress are unavoidable, travel, work presentation, prepare for a potential migraine attack and try to take care of yourself as much as possible. Sleep. Sleep is a biggie. This is a sleep diary. I just want to orient you before we kind of go any further. So that kind of yellowish stripe in the middle, that's midnight. And somebody would shade in times they're asleep. They'll put slashes for time they're sleepy. And then they'll put arrows for when they go to bed or on the couch or get up from bed or wherever else they're trying to sleep. So what are the problems people can have with sleep? There are lots of problems. In this first person on Monday, you see that this person is napping. They're napping. They went to bed. They were sleepy all afternoon. So finally they go to bed at 3. They laid in bed for an hour and then they slept for 2 hours. They get up at 6. Well, that nap means that they're not really, they get a little bit tired again. They try to go to bed at midnight, but they're not sleepy yet. So they're laying in bed for an hour, not sleepy. Then they lay in bed for an hour, sleepy. Then they finally get a little bit of sleep, but they're laying in bed. They wake up. They're laying in bed all through the night. And, they if you count, they didn't get very much sleep at all that day, and all that sleep was fragmented. So here we have a problem with sleep onset, where people went to bed but didn't fall asleep immediately. And we also have wakings, these periods of time in the middle of the night where you get up and it's more than just going to the bathroom. It's more than just a couple minutes of being aware and then falling right back to sleep. It's 20 minutes or more where they're just up in the middle of the night. There are all kinds of challenges that people can have. You see this very last one, this person on Thursday, they don't have any trouble with sleep onset at all. They're sleepy, they go to bed. Great, they fall right asleep, but they still, they're having problems in the middle of the night. So something that looks better is something like this, where you may be sleepy for a while, but as soon as you go to bed, you go to sleep. If you get up in the middle of the night, you get out of bed until you truly feel sleepy again. And as soon as you go back down, you go to sleep. That's kind of what we're looking for good sleep. So the big question for people with migraine is, how can you get there? For people with migraine, we're always a little bit careful with sleep, because poor sleep is a migraine precipitant. So we don't take big radical changes with people with migraine. We go slow and we ease into it with a strategy that's called stimulus control. Stimulus control treats the bed as though as the stimulus for sleep. So I'm sure some of you are familiar with Pavlov's dogs. Pavlov was a researcher a long time ago who rang a bell and gave food to dogs, and they would salivate because there was food. And eventually he would ring the bell, there was no food, the dogs would still salivate. We want your bed to equal sleep. Anything that is not sleep or sex, you should not do in your bed. Reading, no. Phones, please no. You know, there are lots of things that we can do in our bed. Studying, no thank you. Watching TV, please no. We want the bed to be the bell, and we just want you to fall asleep when you get in it. That's the goal. So how can we do that? Well, you need to be really sleepy by the time it's time to go to bed, and napping is a problem. Now, when you have a migraine, sometimes the best thing you can do is take a nap until it goes away. So that's one reason why sleep is often disrupted for people with migraine, is because napping is a great coping mechanism for some people for migraine attacks. That doesn't mean you have to stop napping. It means you need to do everything else more, right? You need to use the strategies you use to treat your migraine. And then you need to try to, hit sleep with everything else you've got. In general, you want to have a regular rise time. You want to get up at the same time, even on the weekend. So sleeping in on the weekend is actually a major migraine trigger. We want you to go to bed only when truly sleepy, not tired. Your body can be tired, but your brain is not tired yet. That's not a good time to go to sleep. You want to go to sleep when you feel like you'll just pass out. You want to get out of bed anytime you're not sleeping. You don't want to stare at the clock, but if you've been in bed for about 20 minutes, 30 minutes, it's time for you to get out of bed. Read a book, play a puzzle, do jigsaw, whatever, until you're truly sleepy again. And in general, we want to reduce sleep interfering activation at night. So if you're doing that deep breathing stuff, maybe try it at night. You want to give yourself a good hour where you're not watching TV, you're not playing video games, where you're doing things that have low light, because the blue lights in these computers, they're both not great for migraine, but they're also not great for sleep. It's great to give yourself some time to unwind, have a nighttime ritual. You want to time your exercise well. We want you to be physically active, but ideally it should be during the day and certainly not within the hour before you want to go to bed. In general, we want to avoid stimulants like caffeine. We want to avoid alcohol or eating right before bedtime, because that will interfere with your ability to go to sleep. People with migraine can benefit from an evening snack, but you want to make it small. You don't want to have a big meal right before you go to bed. You may want to have a small peanut butter cracker or something in that kind of vein before you go to bed. We're going to go through diet and exercise. So diet, what are the things that matter? The things that matter for pretty much everybody with migraine are caffeine and alcohol. So for caffeine, people with migraine, we typically ask to limit to less than 200 milligrams a day. That's like a big cup of coffee, a big cup of full calf coffee. You also want to keep it, I think more than this, you want to keep it consistent every day. So when you think about why do migraine attacks so often happen on the weekend, people don't drink their coffee. Or if they drink it, it's like really late. Your brain is expecting that coffee. Give your brain the coffee. If you drink coffee every day, don't say, I'm going to do my migraines a favor and not drink coffee on the weekends. Drink coffee, drink your coffee, drink it every single day. Don't change it just because it's another day of the week. It's an important, drug that your brain gets used to, and you don't want to surprise your brain. For alcohol, we want to limit intake, but what that really means is don't binge. For women, have one drink. For men, have two in a night. Don't drink more than that at a time if you have migraine. If you want to be able to drink one drink on special occasions, if that's important to you, you shouldn't only drink at that wedding. Again, we don't want things to be a huge surprise to our brains. So if you are somebody who can give up alcohol and it's no big deal, by all means, it's a, classic migraine management behavior change strategy. But if for you that just does not jive with your idea of a whole and full life, don't only drink on special occasions when everything else is also weird. Have an occasional one drink at night so that your brain doesn't get so surprised by it when it shows up at a wedding. If you have a long list of specific foods you're trying to avoid, try not to. see what would happen if occasionally you do introduce some of those foods into your diet. Remember, the foods you want to eat shouldn't be surprising. On the other hand, if there's foods that you don't care for and you feel like they give you a migraine attack, then, it's not a problem. You should do the things that are valuable to you. The thing about diet that seems to matter most is having a routine, consistent, healthy diet. Don't skip meals. Try to eat every couple of hours throughout the day. And there are a lot of diets that have demonstrated some efficacy to reduce migraine attack frequency, like the MyPlate diet, which is our kind of government's typical healthy diet, the Mediterranean diet, as well as keto. The thing about keto is that it is a really, really drastic change for your body. And it is difficult to actually do keto for a long period of time. In fact, all the studies have only looked at people who do it for 4 weeks and then they're off the diet. So it does seem like people's migraine attacks may improve during keto, but then they come right back afterwards. And it's not typically something that you can do for a really long period of time. So other more moderate healthy diet changes may be a better long-term strategy for the average person with migraine. The last behavior is exercise. So it does look like routine aerobic exercise can reduce migraine attack frequency and improve your overall health and vitality. The problem there is the migraine attacks get worse when you're doing physical activity. So we like to use SMART goals in behavioral medicine to help people kind of set intentions and actually make them. So a SMART goal is something that's really specific. It's something you can measure, so you know if you did it. It's an action. It's not a feeling or a try. It's very realistic and it should be very time bound. So if you know that it would be unrealistic for you to try to run for 30 minutes a day, don't make that your goal. If what's realistic is for you to walk for 20 minutes a day, then that's a great goal. You should give yourself some flexibility in and around migraine attacks because there is no reason to make your head pain worse just so that you can do a little bit of aerobic exercise. At the same time, if you are always dealing with some kind of low-grade headache, it may actually be extremely helpful for you to do some low-grade aerobic exercise. So making a goal that is small and manageable and that you really feel like you can do, grab your friend, grab your partner, they can do it with you. That can be a really, really good strategy to get on the horse, to start the plan. The last thing I wanted to talk about is values. So you are not migraine, right? You are a whole human being and migraine is something that you're experiencing. So one of the things that I like to do with everybody I talk to is ask, what are your values? What is it you actually want to do? Every week, every month, every year? Where do you feel like you're really hitting it out of the park with your values? And where do you feel like you need to do a little bit more work? And focus on what will help you feel like your life is whole and meaningful. Because when your life is whole and meaningful, the more and more migraine will recede and it will only be a part of the things that are going on. Thank you so much. I cannot see the time because this is so large, so I'm not sure where we're at.
I know, I can't see the time either. No worries. It was wonderful. Thank you so much. Let me check and see if we have any questions. I do not.
5 over. Sorry, guys.
Oh, no worries. No worries. You started late too, due to probably my introduction. I think everything started late. Thank you so much. So I'm traveling on Monday, so now I'm already stressed. No, I'm joking. I'm prepared. My doctor and I, yes, my doctor and I spoke, and I am prepared for what ifs. So if anybody's going to retreat migraine, I don't know if you all know about that, but if anyone's going there, make sure you speak to your doctor and you are prepared for your travel and for your weekend there. That's the best advice I can give you. And for anybody that wants to start some light exercise, I suggest getting a puppy or a dog. That will help too. That helped me in my journey of starting to walk a bit. But I thank all of you, our speakers today. You were fantastic, and thank you so much. We're going to put our survey in the chat section, in a minute or two, if you would help. It really does give us good feedback for our education days. But while you guys are doing that, I want to thank our presenters. All of you were amazing today. I learned so much, and I thank you so much. The surprise that you spoke about, Dr. Seng, was it was just spot on. I mean, it really is true. So thank you for that little bit of advice for all of us. Don't forget about our virtual live run, walk, relax events. Our virtual support groups are fantastic. Our mindfulness events every other Thursday are free. You just need to sign up and get the link to join them. And I hope everybody has a great weekend wherever you are and wherever you live. I hope your weather is good and you can enjoy the weekend and maybe get out and have a little walk or enjoy your day. Does anybody have anything that they would like to share or chat about, or anything? You can certainly put your, you can unmute and chat.
I have a question for Dr. Seng.
Great.
You mentioned the caffeine. Don't change it. I don't drink coffee, never have, but everything I've read says caffeine is a trigger. What if I mean, if caffeine would help, boy, I would be happy to drink a cup a day.
So we wouldn't want you to start necessarily drinking a cup a day. No, and so caffeine can be a trigger, but of course caffeine can also be a strategy for management. So there are some combination analgesics that combine a kind of pain medicine of various types with caffeine. So caffeine is it's a challenging substance to understand a little bit in migraine research. So I wouldn't recommend starting a new caffeine practice if it's not necessarily part of your day. I think what a lot of people with migraine do, though, is that they say, well, I really, really need caffeine to get through this presentation. So I have coffee today, but then I won't drink it the whole rest of the week. And that means that caffeine is more of a surprise to your brain than it would be if you're the kind of person for whom caffeine provides you a great pick-me-up, helps you be more focused, helps you concentrate better throughout the day. There's nothing wrong with it. And a small caffeine habit can help people live a more resilient life than trying to muscle through most days without caffeine and then drinking way too much before a presentation, all of which then means the caffeine is even more of a surprise.
Okay, off to the market to get some coffee. Maybe. And then I wanted to say, I came in late, so I didn't see the first presenter, but I wanted to also compliment Dr. Seng. Thank you. It was fabulous and spot on, as you said, Katie. And Rock, I appreciate your real world experience and sharing that with us and your humor.
Thank you. I try.
It was great. Thank you, everyone.
I came in late, just like the other lady, but listening to Dr. Seng and listening to Ross, I want to thank you guys because I'm coming up on some traveling. And listening to both of you guys have really, really opened my eyes on preparing to travel and be prepared because I'm going into a different time zone. So listening to both of you guys have really opened my eyes and being able to go and speak with my doctor and be prepared because I was leery about traveling with my migraines. Along with some of my other health issues, but the migraines especially, And I just want to thank you for being able to open my eyes some more of what I can do to prevent and be able to travel.
Have a safe trip, Rosemary.
Just raise my hand, see if they call me.
Have a great weekend, everyone.
I raised my hand. Nothing.
Katie, there's 2 hands
Oh,
raised.
Oh, Susan?
Let me know.
Oh, hi there. This is Susan. I've had migraine headache for 50 years, 50. And I do all the things that are everybody says to do. I've just listened to the 3 presentations and they were fabulous. And they were a reminder that I'm doing all these things. And yet, as a chronic migrainer, it doesn't change anything for me. I think maybe I would have less emotional stability if I didn't do these things. But we don't have a good plan for my migraine control, even though I go to the best headache centers and always have. I'm on all the newest, latest and greatest of everything. So I listen and I'm very encouraged that I do everything, but I'm discouraged that I don't really make progress. And mostly I can't control pain. And I'm not really sure what I'm saying, except just to comment that I appreciate these events. And for people that are in a very chronic and severe place and see the best headache centers and do the mindfulness and everything, and attend the support groups, sometimes I just don't know what we are to do. And that's the feeling that I have right now. I'm just discouraged. It's 50 years is a long time.
No, absolutely. And look, one of the things that I always tell, so I'm a clinical psychologist, and one of the things that I try to tell everyone I work with is we can actually help a lot more earlier on.
Mhm.
So, I would love to get the 21-year-old who just started having migraine attacks, because they're that sensitization slide that I just blew right by.
I think that's the one, isn't it? Yeah, that's the one.
Sensitization is kind of the key to migraine, as well as a lot of chronic pain disorders, and unlike every other sensation in your body. So if you light a really strong Yankee candle in a room and you go in that room and at first you're like, oh my goodness, it's pumpkins. But 10 minutes later, you may not notice the pumpkins. That's the way every other sense works, where it kind of acclimates with time. Pain is the opposite. The more pain we experience, the more our brain expects pain and the lower our threshold gets for experiencing pain.
Okay.
So what you're describing is exactly how our brains are designed to work. It makes a lot of sense for things like running away from saber-toothed tigers and, battle wounds in olden days. But for our current modern lifestyles, this is a piece of our basic brain mechanism that's really maladaptive. The more we experiencing pain, more likely it is we are to experience more pain. And I think that your experience is really common. I would say at least half of the people that I work with will describe the exact same kind of situation, because I do work at Montefiore Headache Center, which is one of those headache centers that sees a lot of people who are have been dealing with migraine for a really long time. I hope that you can see that you're doing everything that you can, and that migraine isn't your fault, and that there is, no chatty Cathy at the water cooler, like Rock was talking about, who's gonna, that you've already done all that. And the best thing that you can do is just to try to stay positive and to keep moving forward and to keep working with your medical team. People who have migraine, have seen in the last 5 years, right, that there have been pretty significant advances in migraine treatment. And there are new advances every couple months. There's something new right now, and it's a time that is that I have a lot of hope for the future, for people who have been having migraine for a long time, that we may be able to find new mechanisms specifically for people in your situation. But I just want to, comment that it sounds like you have a long history of being extremely resilient in the face of this disease. And I hope that you can be, a good example for both people in this group, but also for people in your life, that they can see how well you're managing such a challenging illness.
Well, thank you. I have just one really, I know we're supposed to be ending, but really quick. Thank you for that. It really helps me to stay grounded and centered. Given that, even though I'm at the best headache centers and the newest and greatest stuff hasn't done anything, there is some work right now. And there's a fellow wrote a book called The Way Out, Alan Gordon, that believes that exactly what you said. The longer we've had the pain, the brain is more accustomed in making more pain, just what you said. And there are some programs now that do try to work with people to desensitize that brain. Do you believe that I ought to take a look into that? I'm researching that now because I've done everything I can on the medical side. Should I take a look at stuff like that? I did curable. I'm doing all of that stuff, right?
So I'm not familiar exactly with what you're talking about, but there are a lot of programs out there that can potentially be helpful. I think that the things that you want to look for programs that are helpful are when the person who is delivering the care has some kind of credential. So physician, nurse, psychologist, social worker, some kind of credential that helps you know, like, they have gone through training to help them provide whatever service it is. And that it's associated with some kind of major, at some level associated with one of the major medical centers, because if the treatment that's being offered is also offered at one of the big medical centers somewhere in the country, then it's much more likely to have some validity behind it than something that none of the major centers have decided to do.
It's the new pain research, so thank you. I think I feel good going forward. Thank you. I won't take any more time. Thank you so much. I feel so much better now, because every time I come, I think, what is a person of 50 years? The more migraines, the more pain. It's a cycle, right? So thank you for explaining that. Thank you.
Thanks, Susan. Kay, I think you had a question.
Yeah, I just, the last lady that was speaking that kind of touches on things that are happening with me, like, I've always been a headache person my whole life. I guess I'm now realizing that I probably had migraines even as a child, but I just didn't know they were migraines. And then I had a car accident that after that, I had a really bad whiplash and was diagnosed with migraine in my 20s. So I'm 57 now. I've been living with it all these years. But as the migraines have gotten worse, my whole body pain has gotten worse. So now I'm finding out that does all go together. The fibromyalgia goes worse. All the injuries I had with being a dental hygienist for 31 years, all of that's going together. But what I wanted to really ask about was, so like on Thursday, I had to sleep to sleep off the pain of my migraine. And then, so I woke up Thursday morning, I was up a little bit, then I slept for most of the afternoon. I was unable to get to bed until like 2 o'clock this morning. And then I slept for a couple hours and woke up, slept for a couple of hours and woke up. How could I have done something better I mean, I was up for over 24 hours with this insomnia. So I'm finding that that's becoming worse. What can I do to help myself with that? I mean, I'm trying to do the things like, go to bed at the same time and get up in the morning and do those things. But is there some piece of the puzzle that I'm missing?
So if sleep is really becoming a big problem for you, I would strongly recommend going through a cognitive behavioral therapy for insomnia protocol. There are 2 apps that are evidence-based CBT for insomnia that you can just download right now. Go through a 6-week program and it will help with insomnia if that's kind of the big piece that's going on. For people with migraine, I just want to talk about this specific situation. So you have migraine, so you need to sleep it off so you're not as sleepy that night. It is more important, in fact, it's only important that you get up at the same time every morning. It is not important that you go to bed at the same time every night. You should go to bed when sleepy. Because if you go to bed at the same time every night, regardless of whether you're sleepy, there will be some nights you lay there forever and ever and never go to sleep. And that is basically the thing that kicks off most bouts of insomnia. So for people with migraine who routinely may need to nap during the day to be able to manage their migraines appropriately, I think that it is completely appropriate and totally reasonable for you to expect that you're going to end up staying up later that night. The key will then to be wake up at the same time the next day, even if you're still a little tired, because waking at the same time is what really is the consistency piece of sleep. Going to bed at the same time, that's only if your sleep is extremely healthy and nothing is interfering with it. Everyone here has migraine. I would imagine a lot of people here are, napping during the day on occasion. So that means that's a weird sleep day already. Don't worry about going to bed at the same time every night. Try to wake up at the same time every morning.
Okay. Yeah. I mean, I was laying in bed last night and my mind was racing because I was like, my God, I've been up over 24 hours. I felt like I was going crazy or something, and then you just get yourself so hypered up that it just makes things worse. And then of course I had fragmented sleep with weird dreams and stuff, probably because of making myself get too anxious, so all of that stuff is going on together. It's weird. I used to be such a mellow person when I was younger, and now I'm just like, I'm in pain all the time. I'm more anxious, and it's just like a train that just keeps going along that you can never stop, But can you tell me the name of those apps again, please?
Yes, absolutely. I just put them in the chat. So there's Shut Eye and Sleepio are the 2 CBT for insomnia apps that have been developed by researchers at major, again, they go through all the criteria I just mentioned before, but they're developed by researchers at major universities and are now available in app stores that will take you through a basic cognitive behavioral therapy for insomnia protocol. For people who have really, really problematic sleep, many psychologists are also able to offer CBT for insomnia. You just have to tell them that's why you're there.
Okay.
Wonderful. Thank you. Thank you so much. That's great. I can pass that along to everyone in my support group too. Wonderful. Well, thank you so much, everyone. I'm glad some of you stayed on a little bit, and doctor, thank you so much for sticking around a little bit. It's Saturday, so everybody go enjoy your Saturday with your friends and your family. So